Hi, it's CJ again, Chris. It's day 2 of National Mental Health Week, and today I wanted to talk about medication. Now, I've had experience of medication. I touched on this yesterday. I was put on Prozac, and it worked. I started to feel better. But this is where the level of understanding about mental health and medication kind of separates. It was quite a considerable length of time ago, but the doctor just told me, you better stop taking the medication. So I did. And within a week, I came crashing down and I tried to find as many different ways as possible to crash my motorbike because I didn't want to live anymore. Um, Obviously, I'm still here, so nothing happened. I was unable to crash my motorbike. And I was very lucky, and my family obviously are very lucky on that. And I don't want to kind of minimize the effect that that had on me, but it was a very long time ago, so I don't want to dwell on it. Um, and I've been on citalopram, I think it's called, and Cipramil. I've had lots of different medications, and I stopped taking medication 18 months ago, and I weaned myself off. So I kind of went every other day, and then I went kind of once every 5 days. Then I went once a week, once a fortnight, one a month, until I just completely stopped. And it's been about a year and a half since I've done that, and mostly it's been okay, apart from the last 5, 6 weeks or so, where things have been pretty difficult, to be honest with you. Um, and the doctor's spoken about medication. Um, but the thing is that I am a creative person. I'm a musician, I'm an actor, director, writer. I do all sorts of creative things, and I need to be in touch with my emotions, and I wasn't when I was on medication. And I know that there are lots of different medications available, that perhaps won't have that kind of numbing effect where I just felt like that I was just like where I just felt like I was just a zombie. But I think that it's an easy option, to be prescribed medication. Oh, you're feeling depressed? Here, have some medication. Have some happy pills. You know, it's. I'm not saying that there's not a place for medication, because there quite clearly is, and it can really help some people. But I think that there needs to be an alternative, and it doesn't need to be the first point of call, if you know what I mean. It's kind of it's mental health isn't about medication. Mental health is about being strong enough to get on through the day, being able to talk about it, having the strength to talk about it, having the courage. So I suppose what I'm saying is that it's better to try and find a way around taking the medication and talking about it. Ask if there's counselling available, ask if there's therapy available. There's a website. I don't know. I don't know if it still exists, but it's called Living Life to the Full, and it's basically it's based on CBT, which is cognitive behavioral therapy, and you do it on your own, but it's a course that helps you. One of my first counsellors gave it to me, and it kind of helps you to find your way. So I guess what I'm saying is, don't jump in and say, "Oh yeah, medication." Somebody once accused me of being addicted to the medication, and I wasn't, because I only just started. And at the time, I felt that I needed the support because I wasn't getting it elsewhere. I just needed to stop breaking down in tears and stuff like that. And now, I'm kind of actually, I'm happy to do that. I'm happy that I can actually break down in tears. and stuff like that. So ask for options. You know, I've been offered counselling, um, and counselling is great if you get a good counsellor. My problem with counselling is that I'm like a ferret. I don't let go of a problem, whereas a lot of the time, what you need to do is be able to let it go. And I'm not going to burst into song. Don't worry. Um, but you know, it's important that you do what's right for you. Don't. There's always an alternative. So if you're only being offered medication, ask about counselling. Um, you need to find a counsellor that you build a pretty instant rapport with, because you know, if it's going to benefit, you've got to be completely honest about everything that's going on. You can't just hide away. You can't just kind of, you know, meld the truth to suit the kind of what you think. You know, it's kind of being honest in that situation is vital, because otherwise they can't help you. Try hypnotherapy. That's an alternative. You know, try neurolinguistic programming. There are so many things out there that are designed to help you. Um, and, you know, the counselling shouldn't cost anything if it's with the NHS, but there are counsellors that are available that are private that charge, you know, 25, 35, £40 an hour or something like that. Um, but you've got to do what's right for you. So don't just think that medication is the only way forward, because it isn't. But then don't rely on, shall I say, recreational drugs as well, because although, you know, people claim that there are no side effects to things like marijuana and all that, it's not proven. Nothing is proven. I wouldn't be surprised if there is a correlation between marijuana and kind of depression and dementia and stuff like that. You know, it's, you know, rather than just saying, but I like smoking dope. Well, that's fine. That's your choice. But you've got to look after yourself. You're not going to be doing yourself any favors if you are taking a mind-altering recreational drug, when you suffer with with a problem with your mind, with your mental health. You know, because all that's going to happen, to my mind, is it's going to exacerbate the situation. But that's just my opinion, and I don't want to open up a whole discussion about whether or not to use recreational drugs and stuff like that, because there are medical benefits to marijuana. Apparently, I think it helps multiple sclerosis and other illnesses, which is fine. Okay, I'm not dissing it, but just all I'm saying is just be careful. So that's medication. No one commented yesterday, so I'm not going to talk about questions or anything like that. If you've got any sensible questions that you want to ask and discuss, I'll happily talk about it, all right? But yeah, it's the second day of Mental Health Week. Today, I've actually had quite a proactive day. Just to give you a quick update on my depression, I've had quite a proactive day. I'm kind of feeling okay-ish today. I think I'm going to see the doctor tomorrow, so I'm kind of looking forward to that update as well. But yeah, tune in tomorrow for another Mental Health Awareness Week video. Thanks for watching.